About 5 wards with at least 150 beds have been shut down by the management of the Lagos University Teaching Hospital LUTH due to lack of doctors and nurses to manage them. The chairman of the Health Committee of the House of Representatives, Dr. Amos Magaji, spoke to journalists during the committee's oversight visits to the tertiary hospital. Dr. Magaji attributed the situation to the impact of the huge challenge being posed by brain drain, now popularly coined the Japa syndrome, which is ceaselessly fueling the loss of medical personnel across public and private health institutions in Nigeria. LUTH, and joining us for a clearer look at the current challenge being faced there is the Chief Medical Director of the institution, Professor Wasiu Adeyemo. Prof, it's good to have you join us on TVC News at 10. Help us paint a picture of what the situation really is.
So thank you very much. I hope you can hear me very clearly.
Yes, Prof, I can hear you. Please go ahead.
Oh, thank you so very much. Thank you for inviting me. You realize that this came about as a result of the visit by the House Committee on Health, led by Honorable Magaji. And it is a part of the responsibility of National Assembly to go on oversight for many of the institutions of government that are funded by the taxpayers' money. And that's exactly what they came. That's the reason why they came to LUTH. And they came to LUTH, they saw the facilities and infrastructural renewal present in LUTH based on the budget provided in the last 4 or 5 years. They were obviously impressed. And you know, as also responsible legislators, they also wanted to know what are our problems. And definitely they are aware that there are problems in terms of the people living in the country in droves. And they wanted to know our experience in LUTH. And we told them that our staff have been stretched. The federal government is aware. The Minister of Health, the Coordinating Minister of Health, Professor Mohammed Ali Pate, is also aware. And all efforts are on to actually stem the tide of people living in the country. In the midst of that, they went around, they saw the facilities. They also saw, you know, at the Lagos University Hospital presently, we have about 45 wards. And we made them to realize that about 4 or 5 of them, we are not able to, particularly those that are funded by government, renovation. We have renovated them, but we are not able to continue to use them because many of our nurses are not available. This is well known to government. Efforts are on, and the chairman of the committee assured us that they are also going to put their own effort to make sure that they collaborate with the executive.
Prof, we'll get to that effort. Prof, we'll get to that effort in a moment. But about 5 wards with at least 150 beds being shut down is massive. Tell us, how have you been managing to attend to the hundreds of patients that throng your facility daily?
Okay, thank you very much. Like I told you, we have a capacity of around 960 beds. So, and 150 of the spaces are presently not in use because of a lack of personnel. This is quite very known. And we also have, don't forget that LUTH is a very big hospital. We are almost 1,000 beds, and over 800 of those beds are still being utilized. But don't forget that we are in Lagos. We need to take care of about 220, about 22 million citizens of Lagos. And sometimes when we turn back patients, and it is not because there are no, it is because the facilities there are adequate. However, because imagine if you remove 150 from 950, that is what we are facing now. And definitely, it's going to be a problem, because if you look at in Lagos, we have 2 teaching hospitals, Lagos University Teaching Hospital and LUTH, and the pressure is on LUTH, pressure is on LUTH. And you can imagine federal government has put a lot of money in infrastructural renewal, but definitely because people are leaving, some of these words are not being utilized.
I understand you, Prof.
We do not have personnel.
Yes, Prof, I understand you. And now you are appealing to well-meaning Nigerians for support. What kind of support really are you looking at? You have 30 seconds to respond to that, Prof.
Yes, government is doing a lot. In the last 4 or 5 years, we have seen a lot of infrastructural renewal, not only at the Lagos University Teaching Hospital, but also in many of the institutions, in Nigeria. But you know that just like any other part of the world, government alone cannot do it. There are facilities in LUTH that are not, they are not funded by the government. It is because many Nigerians are responsible. We know that government alone cannot do it. We are appealing to Nigerians to also help us in putting some structures in place, which they have been doing. However, regarding the issue of a Japa syndrome, the House of Rep came in. They wanted to know exactly what effort they can also put in place to discuss with the executive to stem the tide of a Japa syndrome. So that's exactly why they came. And they understand they are going to get back to the Abuja, they're going to get back to presidency, they're going to get back to the Minister of Health.
All right, Prof. We look forward, Prof. We look forward to what will become of this, because there are two different issues now. The facility is available, but personnel is not available. So we'll wait to see what kinds of solutions.
Don't say that it's not available.
Okay, not adequate because people are leaving in droves, right? Thank you very much for helping us get a clear picture of what the situation really is. Professor Wasiu Adeyemo is CMD LUTH. Thank you so much for joining us, Prof.
Thank you very much.